Wonderful. Thank you all so much for joining us. This is the Western Center for Agricultural Health and Safety seminar series. We're really happy to have you with us. Next slide, please. Before we get started, I'll go over a few additional housekeeping items. This seminar is being recorded both in English and Spanish and will be available on YouTube in the coming days. All participants are muted. However, we would really love to hear your questions and comments. So please use the chat function to submit those questions, and we will have time at the end of the seminar to hear from our presenters on them. As you heard, Spanish interpretation is available, and you can choose English or Spanish from the interpretation language selection below. Closed captioning is also available. Select the CC icon and click Show Subtitles. Next slide. For those of you who have not attended before, welcome. The Western Center for Agricultural Health and Safety has a focus both on outreach and on research with the goal to improve the health and safety of agricultural workers in the West. Again, we do this through research projects, trainings, and tailored outreach. We have a lot of resources on our website that we encourage you to check out after the seminar. Next slide. Today, I'm really happy to invite three speakers who work together on a project looking at the health and healthcare access of retired farm workers in California. We have Dr. Bares, Dr. Burke, and Randu Taraz from Cultiva Central Valley. So thank you so much for joining us, and I'm going to pass the screen over to you.
Hi, everyone. It's really great to be here. Thank you so much for having us for this presentation. And so we are going to give you a project update that is titled An Evaluation of Retired Farm Workers' Health and Healthcare Access in California, a pilot study. Next slide. This is just our agenda for today. I'm going to give you a little bit of a background for the reasons for this project, our approach, our timeline to date, and some preliminary results, as well as what our next steps are. Next slide. So to give you a little bit of background of why we decided to submit this proposal and why we believe that this topic is really important is that agriculture is one of the most hazardous occupations in the U.S. Some of these hazards include risks of fatalities, injuries, work-related lung diseases, skin diseases like and other cancers, especially with chemical use and prolonged sun exposure, heat-related illnesses, just to name a few. Additionally, farm workers face exposure to toxic pesticides, both directly, either being an applicator or a mixer or a loader of pesticides, as well as indirectly, either through accidental drift or from residues on the crops that they're working with. And this exposure can lead to long-term health effects. We know that some of these long-term health effects include things like cancers, asthma, and neurologic disorders. A UC Merced farm worker health study in 2022 found that 41% of the people that they surveyed were older than 45 years. So we do know that there is this older population that we should know more about their health and what are their healthcare needs. That study found that 50% do not have any health insurance, and of those that do have insurance, almost a quarter delayed medical care within the last year. So when we were preparing this proposal, we identified this research gap in that there really is limited published data on the health of farm workers after they leave the workforce, as well as really limited information on what kinds of financial supports they have in retirement. So what we hope to gain from this project is really being able to fill a little bit of this research gap because we feel that this gap on the health of farm workers really undermines the healthcare providers are able to give to their patients, particularly with regards to unique occupational exposures and risks. Next slide. So our study had two aims. Our first aim was to identify health-related reasons retired farm workers leave the workforce, um, their experiences seeking care for both acute and chronic illnesses, their understanding of the causes of health conditions, and any kind of financial resources they have after they leave the workforce. Our second aim is to describe healthcare providers' role in farm workers' retirement planning and experience. Um, a long-term goal of this project is to improve aging farm worker health through provider training and care improvements. And we also aim to provide a clearer evidence base for healthcare providers and policymakers to more deliberately and selectively address resources needed for this aging workforce. Next slide. So our approach, our study population, we sought to include anyone who has previously worked in agriculture and exclude anyone who is currently working in agriculture. Initially, we were recruiting participants age 65 and above, but we realized that we wanted to expand that to beyond 65, the typical age of retirement, because we recognize that someone who may have left the workforce, in their 40s or 50s would have a much different experience than someone who was in their 60s or older. So in terms of data gathering, this was done by interviews. And so Cultiva, which Rendu is going to talk a little bit more about in a few slides, they recruited and interviewed 25 retired farm workers. They obtained verbal consent from all participants, and all participants received a $25 gift card upon completion of the interview. These interviews were conducted in Spanish. They were in person, semi-structured, digitally recorded with consent, and interviews are currently in the process of being transcribed and then translated into English. Initially, we had set out that we would interview Spanish-speaking participants, but we did have the opportunity to interview a few that speak in Mexican indigenous language, and this was possible through the help of support people during those interviews. Next slide. And in terms of data analysis, this is an ongoing process, and in terms of qualitative research, we are using the grounded theory method of analysis in order to offer systematic procedures that move from description to analysis and enable theories to be developed inductively. It's a continuous process that began from the first interview and continues throughout the data collection process and beyond. The English transcripts will be uploaded into a qualitative software program called Atlas TI. Each transcript will be coded by 2 research team members, and then emergent themes will be discussed in team meetings. Analysis begins with open coding, in which all potentially significant phenomena, actions, and meanings are labeled with codes, and we will code the data paragraph by paragraph in Atlas TI. Our codebook will be developed through an iterative process in which we will first form an initial set of codes that derive from the study aims.
Good afternoon, everybody. My name is Randu Terrazas. I work for Cultiva Central Valley, and we have the honor to come and work with UC Merced, with Dr. Burke and Dr. Bares when it came time to make these interviews for these workers. I will allow the first little animation to kind of walk you through the timeline of how this all came along. So this all started in September. Conversations with UC Merced started where they wanted people or an organization in the community who was comfortable enough to get people from the community who was connected to these farm workers who then would be able to make these interviews happen. So this is where Cultiva Central Valley comes into play. But through the conversations that we had, we developed this 2-hour training was necessary. So these 2-hour trainings occurred all throughout September. And what the goal of these trainings were to create the questions that would be relevant and important to our community. Not only that, but we wanted to be as respectful to these workers because not only would they have to take time out of their day, usually after work, but we wanted to approach it with as much respect because of what they go through. We know that these people are often underpaid and overworked, and knowing the community we were going to work with, we wanted to provide them with as much care and respect when it came time to make these interviews. So these 2-hour trainings consisted of the rest of the Cultiva staff, Miss Anabel and Miss Claudia Corchado, who we would go together with UC Merced and start developing the questions, right? What information was relevant, and especially how should we ask it in Spanish? Not only so it was understandable for the reporting aspect, but in the moment of conversation that people would feel comfortable sharing more of their story. This took us all through September when we were working on formatting the questions, making sure they were using proper Spanish as to make them feel comfortable, and how could we get as much information by making the people that we were interviewing comfortable. Next little part, please. So then through October, we were getting the IRB approval through UC Merced. I will let Dr. Burke take care of that one. If you guys have more question as to what that IRB process is, it's a little too complicated for my brain, but I'm sure Dr. Burke would love to answer some of those questions as to how that works. Next part, please. So recruiting started in November. And what recruiting meant was that we wanted to make this as easy for them to do. So we went out to them. We know that especially here in the Central Valley, flea markets or remates are very common. And they're usually attended by people that work in agriculture or people that speak Spanish, just because the produce and the sellers are usually very kind. They speak the language, and you get this kind of nice sense of community at these flea markets. So we started there. We wanted to go to the people, approach them, ask them first and foremost if they would be comfortable sharing their stories. And after 1 or 2 questions of making sure they were the right people for this interview, we would pencil them in. We would call them a little later, give them more information as to when this would happen, how it would happen, and what times and what places would work best for them. There was other outreach opportunities where we were able to outreach and ask people to be part of this interview process. Like I said, the process went by going out to these events, getting people to start a conversation with them. That was the way that we would know that, hey, this person is no longer working, they're retired because of X reason, and they would be comfortable enough to come into our office or for us to go to their homes and have these interviews with them. We created a screening question service that made sure that they, once again, weren't working. At first, we had set up this 65-year range because as we were working on the questions, the idea of retirement was going through our brains, and we figured, someone has to be 65 in order to retire. But that quickly went out the window because we realized that, especially in the agriculture world, age is not the only reason why you have to stop working. That could come through injury. That could work out of necessity where you have to care for someone else. So we decided to shift away from the idea that someone had to be 65 to be considered retired, and instead focus on the actual reasons why someone would retire, opening up the door for people who are younger. We had interviewees from the age of 30 to some that were closer to the 90s. That gave us a different input and a variety of opinions as to what retirement and healthcare happens when someone's working. Next slide, please. So we started our interviews in December. We were lucky enough that as we were recruiting, people then would spread the word. And we know that allowed us to facilitate more and more interviews. We started off in our office. People were comfortable enough coming into our office. We have spaces here where we're secluded from everything else. We could give them the privacy that they required, and kind of that welcoming, hey, here's a water, here is a little snack for you while you wait. And while we are doing the interviews, it was a little bit more of a nice space where they felt safe when they were having those conversations. After we did the first interview, we were able to work together as a group to come together to kind of break down what the first interview was like, right? What mistakes we may have made, what could be better, what could be improved. And this is when the decision was taken to change the age of 65, because we were realizing that people would come up to us and tell us, oh, well, I'm no longer working, but I'm younger than 65, but I'm actually not working because I was injured fairly early into my farm working career. And then that kind of got us started talking about, well, people are retiring. And not only are they retiring, quote unquote, their version of retirement wasn't what we think of as retirement. There was no benefits involved with leaving work. They were not getting any benefits. They were not getting any pension pay. They were not getting any of these ideas that we're so accustomed to hearing with retirement. So we even ourselves shifted away from the idea of using the word retirement with them, because la jubilación is something that they're familiar with. They're familiar with the concept, but they know that that's not what the end game is here. They know that there is no happy end. There usually isn't. They're sadly work until they can't work anymore, or their body just kind of tells them, hey, we gotta hang it up. So we shifted from using the word retirement to using the word leaving work, just so that kind of opened the door for conversation so they could explain why they had to stop working. Next, please. And then in January is when everything kind of kicked off. The two people that we had interviewed, they spread the word. Our outreach efforts paid off, and more people felt comfortable coming into our office. So as we were doing these interviews, we would have people come in. We have a nice little lobby set up here. They would come into our office. We would read through the agreements, the kind of structure that we were going to follow, ensure that they felt comfortable being recorded with our physical recorders, walking them through the importance of this conversation. And then we'd kick off our conversations. We like to call them conversations. This allowed us to have from 30 to 50 minutes worth of dialogue with them, because we didn't want to just keep an eye on our watch and be like, oh, okay, time's up. We're done. We got everything we needed from you. We wanted to make them feel comfortable when they were doing it. That allowed us to get more and more detail as to what happened in their story, why they stopped working, why they sometimes didn't feel comfortable going to the doctor, why they waited so long before they brought up any sort of physical issues that they were dealing with. After those interviews were had, we would pause our recorders, then we would place them into our local shared server. So then they would be later transcribed, translated, and then de-identified with the systems previously mentioned by UC Merced. And then we will review them together as a group. For this, I will let Dr. Burke, if she wants to break this down, or I could do it myself.
Sure, I'm happy to jump in. Thank you so much, Randu. That was amazing. It's been such an honor to work with you and with Claudia Corchado and Alanna Bares on this project. We've all learned so much. We had the opportunity to interview, as Randu pointed out, 25 participants, and we had a really nice age range from 40 to 80 years old. And as you can see, the majority were kind of in the 60 to 70-year-old range. We also had a pretty wide range of counties in which our participants worked, which was a little bit surprising. Clearly, the majority worked in Merced, but we had coverage from Kern and Kings to Mariposa. So a pretty nice spread there. And then we also had a wide range of jobs that participants engaged in. And as we're learning from listening to and reading the interviews, people weren't in just one job continuously. They did many different things depending on the time of year and who they were working for. But you can see that people worked in watering, hauler, pruner, planter, packer, harvester, the majority in the harvesting role. And then we also asked participants how old they were when they started working. And as you can see from this graph, we had a number of participants who started working between 10 and 18 years old. And then it kind of evens out between 19 and 45. And then we had fewer participants that started working when they were 45. So pretty interesting range there as well. So this is just a snapshot of some of the demographic characteristics that we learned about from our participants. As Randu described, we did have the honor of really interviewing all of these participants, and the majority in the offices of Cultiva la Salud. And that was really because people were comfortable going there. And as you've seen throughout this presentation, we have some pretty amazing pictures. They were all taken by Claudia Corchado, who's the director of Cultiva Central Valley. And so I'm just going to talk about a few preliminary findings. As we noted, we kind of started the analysis with the first interview, but because Cultiva Central Valley did the interviews very quickly, because they had a lot of people coming to their offices in the course of just about a week and a half, we're still going through and really systematically reviewing these. Well, right now we're listening to the interviews. They're in the process of being transcribed. So what I'm going to share are just some very initial findings. And this first concept about retirement, Alanna mentioned, Randu mentioned, the concept of retirement is not consistent, let's just say. It's not tied to planning or really thinking that I'm going to retire and have a different life that's going to be less work. People actually talked about the fact that they didn't really think about retirement, that they didn't have the benefits to be able to support a retirement. So they usually stop working because they're pushed out of the workforce, more or less. This is just one example quote, but this idea of being pushed out was something that was kind of consistent, that either because of injury or because of an aging body, that they weren't able to harvest as quickly as needed, that they were no longer able to work. So retirement was, as this person says, would have been a luxury, but that we don't have that luxury. We have to continue working. So thinking as a team with what we're learning about how do we support farm workers who are leaving the workforce generally in this age of retirement, what's there for them and what role can providers play is a challenge that we're going to continually work on as we analyze these transcripts. Another area that we were really interested in from the design of this study was what role does the healthcare system play? And what role can it play in supporting farm workers who've given their lives to feeding the rest of the country as they age? And what we learned was that many farm workers did not feel connected to the healthcare system. Many felt that they didn't, as this person said, that they didn't know where to go or who to reach out to for help if they were injured. And that oftentimes there was a fear of going into a clinic. And that fear was related to the environment, not feeling welcome, feeling like this wasn't a place for them, but then also a fear of how potentially irregular immigration status might impact their ability to receive care. So regular care, the kinds of conversations that we would ideally want providers to be having with farm workers as they're planning for leaving the workforce, was not something that most of the people that we interviewed had experienced. Another participant shared that their accessing of healthcare was episodic. And this is something that we heard from a number of participants, that they only went to the doctor when they had an illness or a pain, that it wasn't a regular kind of engagement. And that sometimes they weren't treated well. And as this participant pointed out, the ability to develop the kind of relationship with a physician that is necessary in order to have the conversations that we would ideally like to have happen to plan for the challenges of leaving the workforce weren't necessarily happening because doctors change all the time and they see who's there. That they didn't feel supported in that way. And lastly, participants shared that they felt like they needed to work, whether they could stay in the agricultural workforce or not. So as this participant shared, they were basically pushed out of the workforce. Their bosses no longer called them to harvest. And others shared that they left because of illness, weakness due to chronic illness such as diabetes or heat exposure, and symptoms that they experienced related to pesticide exposure. As this person said, they can see that we can no longer keep up with the work that they demand. Our bodies just can't do it. And this other participant shared that no one waits for you to pay your rent or other bills. So whether you're pushed out of this workforce or not, you have to find something else. This interviewee shared that it's very stressful. For December, I didn't have any money to get my kids anything. I was unable to provide for them, and that made me depressed. I even had a check to make sure I was okay, meaning I had a checkup with a doctor. We would love to work, but our body can't keep up. So the weakness from continual work is something that people talked about, not just this interviewee, but several others. And this link between the stress related to persistent economic need and mental health challenges is something that has come up repeatedly as well. So we'll continue to analyze these interviews and systematically code them to identify the narratives of leaving the workforce and health-related challenges. But this is just to share some very preliminary findings that are key areas that we think are important from these very rich narratives and stories that we heard from these participants. Another area that we will be looking at in depth in these interviews is the narratives of injury and pesticide exposure in particular. So our next steps on this study are to continue the transcription process and the translation of the interviews. We have a wonderfully bilingual team, which is great, but not everyone is bilingual. So we want to make sure that those who are only English speakers can access the interviews, and then those who are bilingual can read the Spanish version and listen to the Spanish version, and then also access the English version. So that is in process. We're also continuing our data analysis. We have a wonderful team of as I've mentioned, the folks at Cultiva Central Valley, Claudia Corchado and Alanna Bares and Randu Terrazas. And then we have wonderful undergraduate students and graduate students at UC Merced, Cassia Garibay, and is a graduate student who's working on this. Maria Garcia is my lab manager. And they're going to be working with us to code the interviews and identify themes. And that coding will inform conversations that the entire research team will engage in. We're very committed to ensuring that we disseminate the results of our studies. So we're working on a couple of different avenues for community outreach. One is potentially an art exhibit featuring some of the narratives for participants with some amazing photographs that Claudia Corchado from Cultiva Central Valley will take. And then we also want to ensure that we are impacting policy as much as we can. So we will be developing policy recommendations based on our data analysis, in addition to writing up the findings for a traditional kind of academic report. And so this is our team. I've mentioned everyone, I think, but we're just very grateful for the opportunity to share the initial results from this project. It's been a little bit of a delay and then hurry up and delay and hurry up, and so we're really excited that we were able to gather these interviews at the time that we were. So thank you so much, and I think we're open for questions at this time.
Thank you so much. Absolutely. Everyone feel free to put questions into the chat. I know this was a very informative presentation for me because, as you indicated, there's so little research and study of this population of workers who we depend on, but what happens to them after they stop working. So going to encourage everyone to put your questions into the chat. One thing that I think might be a common question is, people get Social Security taken out of their paychecks every time they are paid, right? How many farm workers mention that as a source of post-work or retirement income, and how was that discussed, if at all?
I can
Raju, do you want to
I
take?
can answer that question. At least on the interviews that I did, zero. No one felt that was going to be something they could plan for or look forward to. Hence the reason why they will continue to work until they can't anymore. This isn't like Dr. Burke shared. It's a luxury that a lot of the workers in agriculture just do not have access to. They would love to. Like I said, they are familiar with the idea of retirement because in their home countries it exists. But they know by coming here and being labeled as an immigrant, a lot of those rights and privileges are taken away from them. So it's something that they simply don't look forward to. They're just expecting to try to gather up as much income as they can with whatever little savings they have. And in some cases, they will work hand in hand with their son or daughter to try to keep living until the end of their days.
Well, thank you for sharing that. Let's see. So lots of appreciation for the presentation. Curious, sort of along the same line with healthcare access, you discussed some of the barriers to seeing a provider, seeing the same provider in a way that's needed for continuity of care. Has the expansion of Medi-Cal been noticed in the community and the people that you spoke to? Was that discussed? I know that there's been some new accessibility that has come out in the last few years.
I think to some degree, there were definitely some positive experiences with healthcare. But the majority was a feeling of exclusion, and that this wasn't really a place where people felt that they had a place, especially for preventive care. It was more, for injury once there was an injury or an issue. But there were definitely discussions of positive experiences in FQHCs that people accessed. So I don't know, Randu or Alanna, if you have other thoughts.
Yeah, to add a little bit off of that. So at least locally here in Merced, a lot of them are familiar with the local clinics that they visit. And with the expansion of Medicare, like you said, a lot of them are able to go to get some sort of healthcare now. However, tragically, a lot of them waited until they were able to have access to healthcare to receive that help. So for a lot of them, it's too late to get preventive care. and now they're just trying to manage the ailments they already have. So we have conversations where people will have anywhere from like 6 to 10 appointments in a span of like 1 or 2 months because of blood work that they have to do, because they're dealing with asthma, because they're dealing with arthritis. And all of these are just stacked up where because they at no point throughout the work they were able to take the time off or they were able to have this access to healthcare, they are now basically trying to catch up with their health. They're trying to do everything to make themselves feel a little better. But when you have been working for 10, 15, 20, 25 years without seeing the doctor maybe more than 4 or 5 times in your entire life or time of working, it's nearly impossible to really catch up with your health at this point.
Yeah, thank you for that. And I possibly someone from the community who's worked has also raised some important comments. Annabelle Cerna, most do not go back to work full time. They work limited part-time or seasonal jobs to cover the cost of medicine, for example, cover the cost of rent, insurance, reoccurring monthly fees. There's also issues with navigation. For example, having to visit specialists without guidance, language access, complicated online registration, and so forth. Thank you for sharing those thoughts. I actually also, one of the questions I was going to ask, and partially I think because Dr. Bares, you working with OEHA, what were the kinds of injuries or illnesses that came up most often? And I see Annabelle noted joint issues. Perhaps there's other common themes.
Yeah, I think, and I'm gonna turn my camera off because I just froze it, just in case I lose you. Um, Randu, I think can speak to this a little bit more, but we did talk as the interviews were moving along that there were some common things, questions about if they were thinking that their illnesses or injuries were potentially related to pesticides. Some saying, though, that they weren't quite sure what the connection was with some of their injuries or illnesses. I don't think we quite have a handle on exactly numbers yet, since it's pretty preliminary. But we have heard a few times about injuries, pesticides potentially. So yeah, we're definitely looking forward to exploring that more deeply.
Yeah, to what Dr. Bares was saying, and the wonderful Miss Annabelle Serna, who is typing in the chat, is part of our team who did some interviews. So if she's doing all this insightful information, is because she herself also ran some interviews. So thank you. And oh, it's actually Miss Claudia. So Miss Claudia, once again, also did some interviews. So they have amazing insight. But yes, like Dr. Bares said, there's issues with diabetes, there's issues with asthma, there's issues with back spasms, there's issues with stress, uh, any sort of ailment that you would see in the normal world where healthcare is prevalent, they deal with, but without the care. So they are dealing with these stressors of work, but because they cannot seek the help or they simply don't have the access to it, they will deal with it alone. That's a lot of the reoccurring problems. Something as simple as a high blood sugar, where someone is accustomed to going to the doctor, they will just brush it off because they have a shift in the morning. And they're not able to go or call off work and say, well, I can't show up today because I have an appointment. And when they do try to schedule an appointment, they run into some issues there where they're trying to get scheduled in work hours and they can't do it, or they're trying to get scheduled after work hours, but they don't leave work until really late. It's a mixed bag with everybody, but a lot of the ones that Miss Claudia is putting in the chat are just just some of the reoccurring ones. You see them all because it's overworking your body without ever taking care of it.
Yeah, and I would just add to that I think what's interesting in some of these interviews is that, Claudia, Annabelle, and Randus did a really wonderful job of getting people to reflect on their experiences and their kind of work history. And so you had some of these older participants who have been out of the workforce for a while, but remembering this really intense injury that they experienced, and then talking about how it took them a while to get anything done about it, and they kept working, or they didn't realize how bad it was until 6 months later, and they were really getting debilitated. So that kind of reflection and their sort of thoughtful description of the connections between these workplace events that were never really recognized and their current kind of health situation that, as Randu, I think, really described, they're trying, now that they have access, are trying to catch up to address, but it's, the damage has been done to a large degree.
Yeah, thank you so much. We have a question from actually one of our faculty members about the policy recommendations you might make. Obviously, you're still analyzing the data, but who are you hoping to target with recommendations, and what type of policy outcomes might you be looking for?
Alanna, I'm not sure if you want to respond to this. I can take.
Yeah, if you want to start, and I can follow up.
I mean, I would say we're definitely early on in our analysis. So I think that we want to be very careful and thoughtful about the best way to move forward with some of these stories that we're hearing. And especially, I think, being strategic at what level can we really have an impact at this point with some of this information. So whether it's at the local level, or if we're talking state level recommendations, I'm not really sure. So that's, I would say that I can't really answer right now, just because we're really in the initial analysis phase.
Thank you. Go ahead, Dr. Bares.
Oh, no, I was just going to add, in addition to a policy brief, we have discussed how can this be incorporated into training for clinicians that work with this population, because we want to make sure, their time with each patient is limited during that encounter, and we want them to be aware of what their patient's reality is, and what kinds of exposures and injuries they may have had because of their occupation. So this is also very early on, but try to figure out a way of how can we train clinicians and healthcare systems to better care for these patients.
Yeah, that's amazing. I want to elevate one of the comments that Claudia put into the chat. Not one of those we interviewed chose to retire. Every single one of them was pushed out due to slow productivity. They were replaced by younger, faster, and more productive staff. And so the fact that for those you spoke to, it wasn't a desire to retire or a choice, but instead a decision made for them for one reason or another. There's a general sentiment that I know I certainly feel, I think others on the call do, sort of how can we help? What can people, there are community members attending this session, what can be done in your minds?
I can kind of give a little bit of information on this. It's tough. Even as an interviewee, you finish the conversations and you're just left there with their stories, because although you would want to be, I don't know, be a help, right? Be the help that they want or that they need, because a lot of them will come up and tell you that they haven't been working for X amount of time. They're struggling to pay bills right now. They're behind on stuff. And you're just left there sitting with like, how could I fix this, right? A lot of them, of course, they want a retirement plan if it was a possibility for them. They would love the idea of being able to set a time and a date when they can call it quits on the tasks that they're doing and be able to just spend time with their family. a lot of them, when we had those conversations of what would you do if you could retire, a lot of them were just rest. A lot of the answers were rest. They don't have these big elaborate trips to Europe, be able to take off like on a week-long hike. Their idea of retirement or finally being able to stop working is rest. But it's really complicated and really complex, the current systems in place that would prevent them from having a retirement plan. But yes, that's what they would want. They would want to be able to tell their kids, hey, at 65, enjoy whatever time I have left without having to focus on this constant backache that I have, without having to deal with all these ailments.
Dr. Burke or Dr. Bares, do you have any additional thoughts?
I mean, I think that, yeah, as Alanna mentioned, one of the goals that one of the reasons that this study was even developed was to try to intervene at the healthcare level. And in the sense of trying to make sure that providers who do have the opportunity to engage with this population, to make sure that they're actually doing everything that they can to connect them with resources, to identify the challenges, to get them to start talking about, the fact that leaving the workforce is something that might happen and what plans are in place, what kinds of financial resources can they actually access. So that's one way, I think, is we're trying to think about where are these points where information and resources might become available, or we can connect people to them. I think organizations like Cultiva Central Valley do a great job of connecting farm workers with resources. I think making sure that people know that they can go to the clinic now. I think that getting that information out there is really important. So, and there are other things that, when people describe the injuries that they had at work, the exposures that they've had, there's also pressuring these, farm owners to make sure there are hydration stations, to, raising awareness about extreme heat exposure and what it's doing to farm workers, and making sure that people are pressuring the producers to take care of their workforce. I mean, that sounds very naive, but I think that it's something that we as the broader community can actually do. And consumers make a difference, right? You can make a difference, because it's, as I think Claudia put in the chat, productivity equals money. Well, it only equals money if you actually buy their products. So, yeah. I don't know, Alanna, if you have something else to
Yeah, I would just say I would say all of those are really awesome points, and what Annabelle put in the chat. And just to add, finding ways to support your local community-based organizations like Cultiva, because they are this amazing trusted messenger and source in the community. And that was one of the reasons why we were able to get these participants recruited so quickly, was because the community trusts them as a partner for information. So I think, yeah, just identifying those groups within the farm worker communities that you can also support them as well. Because, yeah, Cultiva does amazing work.
I love that. And I agree. I am thankful to have had the opportunity to work with numerous community-based organizations across the state. And, our work is meaningless without them. They are the ones who know what community members and workers need and know how to communicate those topics. So that's wonderful. And Randu, I hope that this is the start of a new collaboration as well.
Thank you, of course.
Yeah. I guess I'll round out, and I just encourage everyone to continue looking at the chat. Claudia is putting really, really great feedback and thoughts in there. From a research perspective, so you talked about the policy recommendations that you might be able to make. Do you see this as a pilot that you then want to do larger data collection on, or do you feel like these interviews are likely to paint the picture sufficiently that you can make concrete recommendations?
Alanna, do you want to answer that? Or?
Yeah, I would say while we've gained, we haven't done our full analysis and we still have lots of work ahead of us to go through all of the interviews. We've gained really invaluable information so far. But even before we started the interviews, when we were talking about this project, we felt like there was the need that we can expand this project and go beyond. So ideally, this would be kind of the first step to, better understanding farm workers after and their needs so that we can support them after they leave the workforce.
Yeah, and I would just add that I think that what we have is a nice descriptive range of, from 40 to 80 years old, some narratives describing people's experiences, but within those, we're really seeing that there are some serious issues at, that 40 to 60 or 40 to 50-year-old range, where people are, that's a very productive age, right? And people are leaving the workforce because of severe injuries. And I think there's a high level of need in that age range that I think definitely behooves further exploration. So I think, as with all qualitative projects, this has created a lot of additional questions and opportunities for thinking about not only further forms of inquiry, but also other points of intervention potentially.
Yeah, that's really important. And I do note Claudia's comment about none of the participants having a workers' compensation claim and therefore probably not getting some of the, if eligible, unemployment and other benefits that they might need. Well, let's see, it looks like there might be one last question. So Dr. Corsandi has it have you observed any successful models or programs that effectively address the retirement needs of farm workers? Have you seen anything else outside of California or elsewhere that really targets retired farm workers?
I have not yet seen something that seems to really work. I'm not sure if Alanna has seen other programs.
No, I would say kind of when we were doing our background research for this project, it's really limited the information that's out there. So no models came up in that research.
Well, we look forward to seeing what you're able to recommend based on your findings and any additional work that you do. I want to thank everyone for coming today. Thank you so much, Dr. Burke, Dr. Bares, and Randu. We really appreciate your time and contributions, and Claudia in the chat for adding as well. I think that the layers of this are very complicated when you think about the age range of the people leaving the workforce. It's not just the people who are typically retirement age. So thank you so much for your presentation. Everyone, thank you for joining us. Please come again in March for another great talk and enjoy your evening. Bye.